The use of partial nephrectomy is rising, at least. It's not as high as the American Urologic Association would hope for, I think, but the message is at least getting out and people are incorporating the use of partial nephrectomy more into their practice. Essentially, you remove the cancerous or tumor element of the kidney, leaving the remaining good kidney behind. So, in essence, for some partials, you can leave as much as 95% plus of a functional kidney behind, as opposed to in the old days, they would remove the entire kidney for any kidney tumor. So this operation is probably the most important operation for robotics, at least in urology, even more so than prostate cancer surgery or bladder cancer surgery. I think the recovery difference between doing an open partial nephrectomy and a robotic partial nephrectomy is like night and day. Since residency and my fellowship, I've done all of them essentially robotically or minimally invasively. That entails about 4 or 5 small cuts about this big in the abdomen. We go in and remove the tumor. It usually takes me about 2 to 2.5 hours to do the procedure, and probably about 95% of my patients go home the next day. Interestingly, the incidence of kidney cancer in the United States is rising. Nobody really knows why. Yeah, the classic symptoms are flank pain, pain in the back, blood in the urine, and in the old days, a palpable mass. You could actually feel a mass growing in the abdomen. It's a big decision in their life, what they're going to have done. You know, I always advise them if they wish to seek a second opinion. I think it's important. I think that we offer good care here, especially in this surgery. I can't stress how much I think that the robotic surgery has improved the convalescence, in particular from a partial nephrectomy, again more so than any of the prostate surgery or bladder surgery that's currently been done with a robot. I think it's sort of night and day.